started. All right, I see people are beginning to dial in. Hello, everybody. For those who are dialing in from the East, good evening. For those who are dialing in the African time zone, good afternoon. And those who are further west in the Americas, good morning. Welcome to this webinar, which I think many of us have been really looking forward to a conversation with the people who make up the majority of the world, which is young people. And I think Dr. Gadinji and I recognize we are no longer in that category. And so we thought, let us turn over this platform we've created for this conversation to the real people who are actually on the front lines of dealing with the challenges and seeing the opportunities that COVID has created on the African continent. And so welcome. We have two amazing panelists, two amazing moderators and three amazing panelists for today's discussion. Dr. Gadinji, anything you want to say as you open before we hand over to the people who are literally taking over the world?
Nothing at all. That just to say that the future is here, and I think this response is in the hands of the young people. The future of healthcare and economies of Africa are in the hands of the young people. So I would like to sit back and listen and learn. Thank you, Edwin.
I'm with you. So without further ado, I'll invite Evelyn, who is the Project Director for Youth in Action at Amref Health Africa, to open the conversation. And she'll be co-moderating with Sandra Kimokoti, who is a Project Manager at Dalberg. So over to you, Evelyn.
Thank you. Thank you, Edwin. And thanks, Dr. Givenji and Edwin, for taking the back seats today. Everybody, good evening, good afternoon, good morning, wherever you are. Welcome to the Africa Dialogues on COVID-19 webinar series. So as you have noticed, the youth have taken the front seat. My name is Evelyn Parijo from YX Youth in Action at Amref Health Africa. And as you've heard, I'll be moderating this webinar with Ms. Sandra Kimokoti from Dalberg Advisors. Now, just to inform you all that your microphones are muted, as is the norm of these webinars. But if you'd like to make any comments and questions to our panelists, please feel free to do so on the Q&A chat box that's available on your platforms. So to the conversation of today, as you all know, COVID-19 is continuing to wreak havoc across the globe. And in Africa, as cases and fatalities continue to rise, the youth have not been spared. In fact, because we form the biggest population on this continent at about 2/3 of the population, we are bearing a big brunt of the effects of this pandemic across all spheres: health, economic, education ties. We have seen increased cases of sexual and gender-based violence affecting adolescents and youth at this time. We have seen youth not being able to access routine health services, especially youth in marginalized regions, youth living with disabilities, and those in key populations. We have seen the looming crisis of teenage pregnancies. And of course, if you looked at reports from the UNFPA, they actually project that if we continue having movement restrictions and lockdowns for 6 months, we could have at least 7 million additional unintended pregnancies across the globe, not just in Africa. Now, take note that these are not just numbers. These are adolescents and youth whose dreams, whose hopes are being cut short. We have seen mental health affecting young people really seriously right now. Research that we did in Kenya just 1 month into the pandemic showed that up to 30% of youth were living in stress, in fear. Right now, the numbers have gone high. We have seen youth across this continent losing their livelihoods and jobs, and of course, so many other challenges. But today's message is that of hope. The youth are rising and are playing a big role in addressing these challenges. We are not just a problem to be solved by other people. So the youth are implementing amazing interventions as innovators, as researchers, as community mobilizers, name it. We have seen young people in DRC's Amani Institute who went all out and formed this brilliant network to reach out to young people in the remotest parts of the country. We have seen young people in South Sudan who went online with a very interesting hashtag of 211 check to actually address misinformation around COVID-19 within the youth population. So today's conversation has this positive outlook that as we develop policies and programs for the youth, we are acknowledging that young people are a powerhouse in their own way. So this conversation is going to be very exciting. I now want to hand over to Ms. Sandra to tell us a bit more about the exciting lineup of panelists that we have today.
Thank you, Evelyn. I'm very excited to welcome today's panel, all leaders in their own right, working with and for youth across the African continent. First up, we have Irene Siao, whose background is in public health. Irene serves as the Youth Country Coordinator for Ghana's Sexual and Reproductive Health and Rights Alliance for Young People. Let's dive right in. Irene, I invite you to share your remarks, and please start by telling us, what are you seeing as the impact on sexual and reproductive health and rights of young people across the continent?
Hello, everybody. My name is Irene Siao. I work as a Youth Country Coordinator for Ghana SRH Alliance for Young People, just as Sandra mentioned. And indeed, there has been a lot of effects of COVID on the SRH of young people. I mean, there are stories I hear every day. There's been articles, there have been different reports about the effects that COVID has had on our SRH, because as Evelyn rightly said, we make up a majority of the population. In Ghana, young people make up about 30% of the population. And so that's quite a number. And so any issue that affects us, of course, has huge implications. For instance, let's take the instance of services, where in one of our partner facilities in the northern region where we're running our GUSO program, the number of young people, the number of service uptake has about halved. From when you count from January to June, there was a higher uptake of services. But then when we check the statistics from April to June, there's been about half the number of young people who usually used to go for services accessing services now. And then this is possibly because young people perceive the health facilities now as a hotspot for COVID infections, and so they don't really want to go there anymore. I was chatting with a peer facilitator about last week, and he told me that he referred a young lady to go for services through a WhatsApp. Then she told him that she didn't really want to go right now because she was afraid of like going to the health facility at all, because we now see the health facilities as areas where one could easily get infected with COVID. So it's affecting the services that young people can go to access. And so at the end of the day, this is going to cause a lot of implications on the SRH of young people. And then also another effect is in terms of the delivery of reproductive health education to young people. So that has also gone down now, because as a result of COVID in Ghana, about 9.2 million basic school students are now home. So it means that the reproductive health education that used to be delivered physically, face-to-face, can't be delivered anymore. And so young people now have to resort to other ways to get education, and then we don't know how correct these are. And so it's really causing an effect on the SRH of young people who are not able to really deliver the SRH information, appropriate SRH information that would have aligned to deliver. And then, of course, I think Evelyn mentioned the higher rates of SGBV, and then it's rather unfortunate that we have this going on now. Indeed, in Ghana in May 2020, UNICEF had a poll, a U Reports poll with about 1,500 adolescents and young people. And then in this poll, they saw that the prevalence of abusive and violent behavior has increased by 32% as compared to levels in February 2020. And so this is quite worrying. Even in West African countries, other West African countries, we see and hear reports every day of young people who have unfortunately been killed after SGB. I mean, there's been a whole lot going on, and it's really impacting young people negatively. So COVID has had a lot of effects on the SRH of young people. And then also there's the terms of economic stress as well, where young people like myself may not have enough stable jobs. And so because of COVID, young people have had to lose their jobs or take pay cuts. And so that has also affected the SRH of young people a lot. Recently, in one UNICEF report from June 2020, they donated a number about 8,200 dignitary kits to young people in the northern parts of Ghana who had to leave their jobs in Accra. Their jobs, they're called Kayaye. So Kayaye basically means that they are headquarters in the markets, and so they make their living off um, helping people with carrying their goods when they come to the market in the northern. And unfortunately, they had to go back to the northern parts of Ghana because of COVID, because of the lockdown, and then they've lost their source of livelihood. And so this affected their menstrual health. It has affected, of course, their ability to take care of themselves and their families. Now, some of these Kai are also young mothers, so that has also really affected their health. And then, thankfully, UNICEF did something for them, but of course, I think there's more to be done. So I'd say that the challenges are numerous. There's the HGBV, economic stress, the lack of access, limited access to productive health education. And so unfortunately, just as Evelyn said, as UNFP has projected, this may cause a lot of effects on the SRH of young people, even in the years going ahead. Yeah. So that's what I say are the challenges. And then despite these challenges though, we've had some pretty good innovations that have been done by the Ghana SRH Alliance for Young People. The Ghana SRH Alliance for Young People is made up of 7 partners. And so together with our partners, we've been able to bring about some very good innovations to at least try to mitigate the effects of COVID on the SRH of young people. So for instance, we now have a forum called the Young Voices Forum, where young people from one of our partners, Savannah Signatures, host a chat every Friday. And then on this chat, so young people, it's held on Facebook. And so young people get the chance to have some SRH information. Quite recently, we had the World Menstrual Hygiene Day celebrations done on Facebook, where young people had topical conversations, very interesting conversations around menstruation, around menstrual shame as well. And then also young people have had different conversations around child rights in Ghana and around COVID as well, of course, because it's also a very important thing for young people to keep safe in this area. So that's one great innovation. In fact, I was speaking to the moderator, who is also a young person, and the moderator was telling me that young people have really taken up this more. And so it's a very good chance for young people to have access to a lot of education, because first they couldn't really access it because they were at jobs or things like that. But then now, because it's online, they can really access it. And also we have a helpline where young people can call to get access to SRH information. And so they are really taking access of this helpline now. And aside from that, we've also had various Twitter chats from young people in different areas where we've been able to really reach out to other institutions, government institutions. One of these chats on SRH and COVID, the effects of SRH and COVID, recently was publicized on national television because that day trended. And so that was really a good way to have our voices heard as young people. And so I've spoken about some challenges, some innovations that have been done. And to end, I'd also like to share some recommendations that could be done to support the SRHR of young people, even in these times. So first of all, I'd like to say that we still need to provide services to young people in this area, in these times of COVID. And so what could be done by institutions is that some staff should still be allowed, of course, staff who are safely wearing their protective PPEs and then all that, should still be allowed to reach out to young people with services. We should be able to make our service centers as accessible as possible. young people should know that they are able to come and then access services. They should be publicized to young people. And then of course, we should have limits on the number of young people coming in all the time so that at the end of the day, we still provide young people with services, but then still make sure that they are safe. And then also, because SGBV is on the rise right now, I also think that another thing that could be done is that police officers could be deployed to the communities just to scare off some perpetrators of SGBV. I think that would do a lot because unfortunately there are so many cases now. And in terms of the services, of course, health facilities could also redesign their youth corners, as I was saying, make sure that young people are safe when they visit, have a lesser number of staff available there so that young people can still access the services that they need. And then, of course, because I was talking about economic stress, I think that some things that could be done could also be that development partners could come in to support the government in terms of delivering text-based information to young people. Development partners could really support government to do that so that we have text-based SRH information, COVID updates being shared out to young people, because not everybody will be able to access the internet, of course. And then also at the community level, so donor partners could also support the laudable initiative of UNICEF, where they distributed sanitary kits, dignitary kits, because young people have lost their sources of income. And so this would be a really sustainable and a really laudable initiative at this time to support the SRH of young people. So my name has been Irene, and these are some of the challenges, some of the innovations that we've worked out in Ghana here to support the SRH of young people, and then key recommendations I think that governments and development agencies could bring about to support the SRH of young people during these critical times. Thank you very much for this opportunity. Bye.
Thank you so much for those remarks, Irene. We'll be coming back to you in the Q&A session. Our next speaker is Bernard Karanja. Bernard is the president of the Kenyatta University Students Association. What's even more exciting is Bernard's an innovator. He's part of the team that produced the first domestically manufactured mechanical ventilator in Kenya. Bernard, we are very excited to hear from you. Please share with us what this experience has been like being an innovator during this pandemic and what the plans for the future are.
Thank you very much. First of all, every cloud has its own silver lining. We look at COVID from the negative aspect, the negativity, the much that it has brought. But again, we are looking at it from the other aspect of the much that we can do this as an opportunity. So here at Kenyatta University, we formed a team of students, 16 students from School of Engineering, and the medical team that had pharmacy, medicine, and nursing. And from the 2nd of April, we began making the first locally manufactured medical ventilator. And it has been an interesting journey, knowing that these things can actually be done. First of all, it was tough, the first 1 week making the prototype. You see, moving from the proof of concept to the first version of the ventilator. It was actually a challenge, but the university really gave us a lot, the funding, the support that we required, spending sleepless nights, waking up at 7, going to bed at 5 a.m. in the morning. It was quite a task, but we kept moving on and looking at the possibility, looking at the future, and knowing that